Hello, my name is Julie Nash. The topic I chose to discuss with you today is mixed reality and how it is and can be a part of everyday lives. The objectives for today are for you to be able to define mixed reality, understand how mixed reality has developed, to know how mixed reality is used in overall health education, to understand the benefits and challenges in using mixed reality in dental education, and to know when and why to use mixed reality in dental education. Mixed reality combines virtual reality and the real world. It connects you to the real world and virtual reality all together. You can interact and manipulate both physical and virtual items along with environmental items around you. You can immerse yourself into virtual world while in your own comfortable environment with just a headset. You can be positioned between fully virtual and real environment. It allows you to be in one place physically and another place virtually, literally bringing you real life structures into your own space. According to Intel, mixed reality breaks down the basic concepts of real life and the imaginary world. I was having trouble identifying the differences between all these realities. I searched through Google and found this image to help me identify the differences between all realities. First, we have AR, augmented reality. Bring digital elements into the physical world. An example is seeing, chasing, catching Pokemon characters on your phone, where you are playing the game digitally on your phone, but not fully immersed into the virtual world. Next, we have virtual reality, fully engulfed in a digital world. Examples are Oculus, totally virtual, and engaging you into the game virtually. Then we have mixed reality, providing interaction with physical and digital elements. Examples would be a 3D model or a hologram. Mixed reality brings the structure to you to manipulate it however you choose to. Here is another image I found helpful. We see the physical world, Earth, and the digital world, Neptune, which I'm guessing there. Mixed reality is right in the middle, where a hologram of the Milky Way galaxy can be displayed in front of you here on Earth, and you can navigate, search, and manipulate the digital space around you. Here is a simple timeline of the history behind mixed reality. The 3D image goes back to 1838, where Sir Charles Whitson invented the stereoscope, which is a device that took two slightly different images, one for each eye, which allowed the brain to combine the two and create depth within the image, creating a 3D appearance. Shortly after, in 1849, Sir David Brewster revolutionized the stereoscope by adding a lens-based version and made it handheld. In 1947, Dennis Gaber developed the first holograph image. So in 1950 is where the boom effect happened with the 3D imaging technology. This is when 3D cinema became a trend and has grown more over the years. However, in the 1960s is when holographs started using lasers to create their image. It wasn't until the 1970s when Valerie Thomas made a device that would transmit the 3D image or hologram to appear real, which led her invention of illusion transmitter and later patented in 1980. In 1994, Paul Pilgrim and Fumio Kesino wrote a paper on the concept of virtuality continuum and the taxonomy of visual displays. Since then, mixed reality has come to improve spatial mapping and anchors, hand-eye tracking and speech input, spatial sound, location and positioning, and collaboration on 3D elements. In 2016, Microsoft came out with a HoloLens. It is a headset that allows us to interact with holograms in our own environment, which is still developing into today's 3D imaging technology. This is how we involve it in our everyday lives, not only in gaming, but in work and education. And today, in 2024, Apple Vision Pro, not much has changed with the technology, but it has a sleeker look. How it is used in health education. 3D displays in health profession includes MRIs and CT scans. These allow healthcare teams using 3D imaging by tracking slices of the body part to create one whole 3D image. The health profession has even come to create 3D imaging of a baby through 3D ultrasounds. In dental, we have 3D cone beam images, 3D printing, and 3D intraoral scanners that help diagnose and educate. We have integral images, which is taking an image of an object, processing it, and transferring it into an element image, and then it is reconstructed. There's also holographic display, which is interaction and manipulation of a 3D image without the screen. For example, bringing an anatomical model from the 3D cone beam to life. This helps with training for pre-surgical preparations and preparing for orthodontic applications, or even showing the before and after procedures for extensive dental work. Here we have the HoloLens, where we can explore the anatomical structures of the skull with mixed reality. Its main focus is to mimic a hand-free computer. It helps students interact with the real world and virtual objects at the same time. The HoloLens helps plan for and adapt to surgeries, medical dental education, and patient education. Here is the JAWS in motion. It was a project which was developed by the CWRU School of Dental Medicine back in 2023. They used HoloLens technology to design a 3D skull with a moving lower jaw. This would help educators simulate jaw movements, dislocations, protrusions, jaw joint problems. It helps to deepen the student's understanding and comprehension of the jaw movement. This image is of a 3D cone beam that we use in the dental world. Although I'm not able to manipulate this image in this presentation, we would be able to alter each individual image to pinpoint the exact location for an implant, here in image 1. We would be able to measure the width of the bone in picture 2, measure the sinus cavity from the bone level in picture 3, and in images 4 and 5, measure the angulation for implant placement. The 3D cone beam can also evaluate the jaw damage, the red circles, and identify any abnormalities such as cancerous tumors, or cysts that can develop in the jaw. Mixed Reality Advanced Dental Simulators, or MRADs, is something we've used often in dental education today. It is a simulator with combination of virtual and tangible objects. It assists with prosthodontic education, dental treatment such as simple or complex restorations, tooth extractions, and surgical implants. It also helps with precise locations of local anesthetic and pre and post orthodontic treatments. In dental and dental hygiene school, students inject each other with anesthetic after a simulation on a peach, hot dog, or an orange to feel the different textures. Which this technique is used often, it is not at all similar to actual tissue, and a hot dog cannot give any feedback. Having a simulation would be very helpful in reducing student anxiety, where they are fearful of giving or receiving the injections. They would be allowed to do all injections multiple times versus the one time on a peer before having a final. This technique is much like pilots and astronauts who do all trainings via simulators. The simulators give more realistic experience than food items, but the students would need more hands-on experience. For now, the feedback is just auditory and slight vibrations in the hand controllers. For the future, the New York University dental students are wanting to add different levels of textures and density as we would when we inject tissue and bone. Here is a study done in Poland. The objective was to determine if 3D or augmented reality was more efficient for dental students. The students and participants worked on mock patients prior to practicing on real patients. This study introduced the 3D cone beam, which helps with tooth extraction, implant placement, tumor and cyst evaluation, root canal therapy, and cavity preparation. With the preparation on the images, the top image A, the top row showing the anatomical views and the different angles we can see. The second row showing the cavity prep, again showing the different angles and also showing the depth within the preparation. The bottom image, B, shows the 3D printed image, where on the left is the before and on the right is the after the preparation. Within the study, one of the authors discussed how the hologram device still is not a great real-time navigation, as they could not align the hologram with the actual dental organ during displacement or surgery. The results of the study showed that AR, augmented reality, can be helpful but still needs suitable replacements for physical models. Another image from the same study showing how the HoloLens uses virtual reality to prepare a tooth and prepare the restoration for a tooth. I teach dental materials, so this is something I would be able to use in my course, showing the students the process on properly taking an image, selecting the correct material, and transferring the data to the milling or the 3D printer to have the restoration made same day. This technique and process would shorten the patient chair time, shorten the distance operative time, and reduce human error. However, there could still be computer program errors, transmitting information incorrectly, and human error if it is not done properly. Unfortunately, this equipment is very expensive, and it is not something some universities find necessary at this time for educational use. The other issue is that there are so many different types of 3D scanners for dental education that the person would need certain training for each device. This creates a problem for education, not being able to teach all technology that is out there. Fortunately, the students will eventually learn the new technology at their own employer's office. Another study where a group of healthcare educators reviewed how effective virtual reality was in healthcare systems. They researched if it was beneficial or not to have virtual reality in education. They studied how virtual reality would help improve students with cognitive skills, attitudes, and demeanor, and how satisfied the students were with the process. They searched through 7 databases, all from 1990 to 2017. There were a total of 31 studies and 2,400 plus participants, all students, no patients. The results were found that 8 out of the 31 studies said that virtual reality slightly improved post-intervention knowledge when comparing to traditional learning or other types of digital learning, such as online or offline. 4 studies found that virtual reality improved health professional cognitive skills. However, the study showed a mixed reaction to attitude, satisfaction, and were marked inconclusive. More research or study would need to be done for further analysis with more current data. There are advantages and disadvantages with mixed reality in dental education. The advantages do reduce student anxiety by allowing them to simulate prior to working on each other. It'd be able to visualize the unknown, being able to see under the skin, the tissue, and the bone. It allowed them to be able to measure injection depth accurately. They would also be able to see under the tissue for a mass or tumor, example, under the tongue or in the jawbone. It alleviates stress on patients not showing or canceling. Patients don't like to go to the doctor, let alone coming to the dentist. We do know that patients do get sick and things come up, but they still tend to cancel a lot. It also will help with educating the patient chairside versus giving them a simple drawing. The disadvantages is the cost. All of these devices and technologies are very expensive. On top of buying the device, you also have to buy the software and maintenance and repair or replacing. It does go on and on and on. Another disadvantage is human error. Dropping or breaking the device, not charging it, not inputting information, not having the tactile experience that we need in dental hygiene. We use tactile feel for materials as it sets, cools, warms, hardens. We feel for calculus and tartar buildup on the tooth. And we also feel the textures of the tissues, whether it's firm, hard, soft, or spongy. Virtual reality can also alter our personality and chairside mannerisms, which is very important in the dental practice. Mixed virtual reality is best with combination. So research has found that all virtual reality, augmented reality, and mixed reality are best. And lastly, it doesn't avoid the technology error, where you get the software system down or the cloud base is down. The software needs updating, or the internet's down, or you've lost power. I'm torn both sides here. I would like to use mixed reality in dental education, but there really needs to be more hands-on training in our field. Yes, it is nice to be able to turn a structure or to see past the tissue, but we would not be doing our jobs to the fullest solely using mixed reality. I do know the students would love to use something other than textbooks and listening to lectures all day. Mixed reality would give the simulation experience and time, which would be so helpful for certain situations, such as anesthetic, but would not give real-life personable experience. Don't get me wrong, I love the idea of mixed reality, but would not be the only reality I would use. Here is a link to a 1-minute video that was very helpful in describing mixed reality. Unfortunately, we don't have time to view it during this presentation, but something you can watch on your own if interested. So I challenge you to think outside the box and answer the following questions. If you can trust pilots with our lives to take us to our family vacations when they have simulated 300 hours of flight time, don't quote me on the time, please. Would you rather want a dentist or dental hygienist to give you an injection of numbing agent in the mouth after simulation to a hot dog and 2 times on a pier, or have had 4 simulation experiences and 2 times on a pier? Please give your reasons why. And if you found a lump under your tongue, eventually growing toward your lower outer jaw area, who would you feel comfortable going to? Someone who has had 2D imaging system showing you the image on a computer, or a 3D imaging system and could display your image right in front of you as a hologram? What is your reasoning behind the answer? Here are my citations. Thank you for listening to my presentation on mixed reality. I hope you learned something about mixed reality and also the dental education. Thank you.